Hey, everybody. Richard Downs, and I have online with me Shirley Gutkowski, who is a myofunctional therapist from, is it Madison?
Correct.
Madison, Wisconsin. And she's only about an hour and a half from me, so that's great. And she's been doing some myofunctional therapy for my patients, and I find her services valuable. We use it on little children, and also it can be used for adults. She also has a recorded video available that I'll be showing on my website for sale for $9.95. It's just a quick video on myofunctional therapy for controlling snoring and how to strengthen those muscles in the roof of the mouth and the back of the mouth for helping to improve people who snore. So along with the snore device that I sell, she's been able to complement that with extra help. And she also helps me with my patients who have gotten some results with a mandibular advancement device, who maybe I haven't gotten down to the AHI level that I want. She can add additional layers of improvement to that AHI with myofunctional therapy. She can help children with jaw growth and tongue tie and multiple things. I'm going to let her tell you more about it because I know that she can help me learn a lot more about this particular field that I think will help sleep dentistry a lot. So Shirley, why don't you just tell us what you do and give us some idea of what you can offer to dental practices and chiropractic offices that might want to use your services.
Sweet. Well, let's start by just making sure that everyone knows that our services can be done virtually or remotely.
Right. That's right.
So this is how I do my practice for the most part. Yesterday, I saw 2 local patients right here at our office in Sun Prairie, Wisconsin, near Madison. But for the most part, our patients are just like this. Like your patients, Dr. Downs, when you refer someone to me, they're not going to drive an hour and a half one way to come and see me. So we just do everything virtually. They send us photographs that I request, particular different poses of their tongue and face, and then we kind of talk our way through and figure out what it is that needs to be addressed. So what does that even mean? So it took us almost a year to get this whittled down. So because myofunctional therapy is really, really big. And so what we do here at Primal Air is we work with the muscles in the snoring complex.
Okay.
So the nose, the mouth, the tongue, the back of the throat. So we get all of that to harmonize better so that the airway opens better. Once the airway is open, a lot of things improve. We do that by asking the tongue to act in a particular way and by strengthening the muscles here in the cheeks and the mouth. We get the mouth to close. Now we're recording this today with this COVID-19 problem, and nasal breathing is one of the solutions to personal infection control. Washing your hands, washing your nose, keeping everything in the nose where the nitric oxide builds up, and that kills the bacteria.
Right.
Not everybody can breathe with their mouth closed. I was you know how things end up in your house sometimes, and I was looking on the counter in my kitchen, and here is from 1976 my state ID. What is that doing out of the basement box where it's been forever? My mouth was always open. My upper lip was always riding high, and you, Dr. Downs, see this as a dentist a lot. Dental hygienists see it all the time too. The gingiva is all red here. There's plaque on there. Sometimes we see a brown line where the lip kind of goes over the teeth. We can get that muscle in myofunctional therapy to relax and close together so that lip closure is possible and nasal breathing is improved.
Nasal breathing is really important. We know we're finding out more and more about it, and the fact that nasal breathing in children causes the jaws and the bones to malform as they grow up, and continues to create a further problem for sleep disorders as an adult. So early on, we want to get that handled, right?
As early as possible, exactly. So if you have a baby that has a lot of allergies,
Mhm.
that needs to be taken care of right away. This is an escape hatch for breathing. This is
Mhm.
not to be used, the mouth is not to be used for habitual breathing. I know that I used to have nightmares that bugs would crawl in my mouth because I knew it was open, but nobody said anything about that.
Mhm.
Um, so it's important for facial structures and the growth of the face. There was a landmark study done in the 1980s where researchers plugged the nose, the nostrils of certain kind of primates. I'm not going to say monkeys anymore because they probably were some other something, some kind of a primate. And every single one of those primates ended up with a malformed upper jaw, and the lower jaw was forward and the tongue was sticking out between the teeth.
Right.
And they only blocked those sinuses, those nose nostrils for 18 months, and it
Mhm.
changed the face forever. So we need to get this thing addressed as soon as possible.
As a dentist who went through training and graduated in 1975, we were taught some rudimentary things about tongue thrust and putting in rakes and spikes till they would stop doing that. And uh, we were unaware, really, uh,
Right.
other than a rudimentary level, how to control these problems and how important they really were. We knew that there was some jaw malformation from these tongue thrust situations, but we didn't know what was causing it. It was just a habit that we were taught. And tooth grinding was just something that was stress related, and so it wasn't related to breathing disorders. All kinds of things that I've learned since then, and now I'm learning from you. Maybe we can do something that would intervene in the development of these faces, as like an oral DNA appliance will do, to help
Mm-hmm.
people reach their genetic potential for growth. And I think these epigenetic factors that you're talking about are becoming extremely important. I want to use them in my practice, and the fact that you can do this in all 50 states with telemedicine is exciting to me. So that's why I wanted to introduce you to this professional community.
Thank you. It is an exciting way to deliver care. Um, and we can practice in all 50 states. At Primal Air, we have 6 therapists with different backgrounds. We collaborate on different patient examples so that we
Mhm.
can all learn from one another and give our input when somebody is at a point where they can't like figure out, or they are having a hard problem to solve with a patient who can't do certain maneuvers. I
Yeah,
have a patient right now who had her tongue tie released, and
she's a dentist, right?
yeah,
Yeah.
yeah, and she really wanted to have that be a solution for her. She was having neck and shoulder problems. She was having some breathing issues. And when we were going through the techniques and exercises and postures that I was asking her to do after the release, we have to kind of reactivate the tongue and teach it what to do. She couldn't do one particular exercise at all. And we had to like reconfigure everything. The back part of her tongue, the posterior of her tongue, was, I call it atrophied. I don't know what else to say. It had never been used before.
Hmm.
She'd always been swallowing in a way that that just kind of compensated for that restriction. And so we had to kind of wake that tongue up and get the swallow to
Hmm.
work properly. You were talking about tongue thrust. You should see in the myofunctional therapy groups how they're like, oh no, it's not a tongue thrust. It comes from something.
Hmm.
And that thrust is usually accompanied by a tethered oral tissue or a tethered tongue.
Sure.
In dentistry, probably about the 70s, it was like, well, it's elective surgery. They can talk, they can eat, they're growing. So we're not going to bother with releasing the tongue. And now I'm seeing 60 and 70-year-old people that are having their tongue ties released because they can no longer compensate for that restriction.
Well, the babies that have this can't latch, and that's terrible for jaw growth and your
Mhm.
inability to get the proper nutrition and body development, upper airway development that they need. So we wonder where all this sleep apnea is coming from. It's allergies and um, uh, tongue tethers and all kinds of things that need to be corrected early on so that they can develop normally. So thank you for that. Shirley, I'm sure the dentist on the forum and also the other health professionals would like to know, do you train offices and how to do myofunctional therapy?
Not how to do the myofunctional therapy, but what to look
Okay.
for a referral. Because the training for myofunctional therapy is pretty long and intense. They make it sound like it's just a weekend class, but it's like 5 weekend class, and they're about $2,000 a weekend. So I do train offices to identify these problems
Uh-huh.
so that the parents, if it's a child, can act quickly right away when this is noticed, and then refer them to either us or a local myofunctional therapist so
Yeah.
that these problems can be resolved quickly.
Well, telemedicine would be great right now for those people who need it, especially when everybody's isolating right now. So, what is the fee for an entry level office training to get people aware of how we can help these sleep apnea patients, breathing disorder patients in your that you provide?
Well, and you just hit right on the the top thing right now. One is that we're all in isolation and we can do the training virtually right now while your offices are closed. So
Sure.
you can make use of the time. Two, we were just talking about tongue tie. We already talked about sleep apnea. We talked about tongue thrusting. We talked about all these different things. And
Snoring.
I've been, I know, to whittle it down to, and we didn't even talk about jaw joint pain and all of this stuff that are all contributed from the soft tissue. So I've whittled it down to a day and a half worth of training. Everybody can do it from their own home. We can just broadcast just like this to, your dental hygienists or chiropractors to train what to look for, what's happened, why it's a problem, why you have to move forward with this as quickly as possible, what makes a good referral, does the person need to be at the office, can they be seen virtually, all of that. I got that all squeezed down into a day and a half's worth of training.
Uh-huh. What is the fee for that?
Fee for that, sorry, is $14.97.
Okay. And so dentists should treat you like they would a referral for a root canal or a specialist in oral surgery or periodontology. You would be treating remotely, which you can do, and you're just a specialty referral like any other specialty referral. Is that right?
Yes, that would be exactly right.
Okay.
So sometimes some patients need to have an appliance made, so that would be on the dental side, or if the tongue tie was present or any kind of other soft tissues restraints, the dentist would be the one to do that.
Right.
So there would be, some kind of a business for the dentist as well.
Well, of course. I mean, absolutely. I mean, I do tongue tie releases all the time, and we do palatal expansion and forms
Yeah.
of airway opening that we can do. We certainly put people in mandibular advancement devices, but they don't always work as well as we want them to. Many times they work wonderfully, sometimes they don't. But
Yep.
even those that work well, are you able to wean some patients off of care with mandibular these appliances? Can you help people with CPAPs?
We can. One of our therapists had her tongue tie released,
Mhm,
and she went also through the myofunctional therapy,
mhm.
which we did together because it's hard to do on your own. It's hard to stay motivated. She
Right.
was able to reduce her scores on her CPAP machine to half.
Okay.
So if we can reduce it down to half, a lot of times you don't even need the CPAP anymore.
Right.
Or you may be able to get away with just a mandibular advancement device.
Right.
Sometimes people get choky or they just are never comfortable with those appliances. And so we can help them be more comfortable with them.
Now, Shirley, you advocate, of course, getting a baseline sleep study done for your patients who are getting airway therapy from you. Is that correct?
Yes, that is part of our treatment
Now,
protocol.
you've used my online homesleepstudy.com
Mhm.
sleep study testing site, have you not?
Yes,
How'd
simple,
that go for you?
super simple.
Good. So your patients are ordering online.
Mhm.
You get the report from the doctor who is a sleep medicine MD specialist in sleep. And also they send you a prescription for mandibular advancement device, a letter of medical necessity, and the diagnosis. All of that gets included in that fee for that, right?
Yeah, it's just all right there. It's a complete package.
That's great. And surely that fee of $275 for an online home sleep test with all those particular uh, characteristics about it and all the offers that come with it. How do you feel about that fee?
I think it's too low. I think it's a bargain.
I think so too. And then
Yeah.
again, I offer that all over the country and in all 50 states, and the physician who makes those diagnoses and letters of medical necessity can do that for anybody in all 50 states. They're licensed in all 50 states. And it's just a very convenient way. This particular process that I do online is not insurance based. We're not using insurance because generally the deductible, if you use insurance for these home sleep studies, you'll pay more out of pocket than you would just getting a cash purchase of the online home sleep study. And you don't need a physician's referral or an insurance authorization or a board approval, medical or dental board approval. There's no laws against getting this test for a patient who wants to buy it. And so that makes it attractive. Now, there are many insurance-based models out there, and that's fine if a person wants to go that route.
Right.
Generally, though, you can see that they're going to be paying more. Now, with the exception of Medicare right now, you have to have a face-to-face with your private, your PCP in order to get authorization to do the sleep study. But I've been telling those patients, even those patients, that go ahead and do the sleep study, pay the cash that you need for it, because some of these PCPs are not even prescribing. They won't prescribe a sleep study when I know they're needed. And so they could get that sleep study. It proves that they have sleep apnea. Then they take it to their PCP and get an authorization for another sleep study, which is kind of cantankerous way to do it.
I
And
know.
then they can go ahead and proceed through the medical system with Medicare approval, just like they ordinarily would. They may need another sleep study, but at least it gets them on the road, and it forces the hand of people who are blocking their way to get treatment. So that's the way I see it.
It's really important to have a separate option. Not everybody wants to go through their insurance company.
Absolutely.
Even if it were to be covered 100%, it could impact their livelihood.
Absolutely. The DOT truck drivers that I deal with are very, very private.
Yep.
They don't want their test result. They can order the test, pay cash for it, just like anybody else. They can keep that private from their doctor and their dentist and their insurance company. No one has to know the results. They have complete control over the privacy of this test. You don't get that when you have insurance authorized or a physician authorized or prescribed treatment for that HST. So the privacy is one of the biggest issues that we're addressing. We're also going around roadblocks for getting treatment. There's 54 million people in America undiagnosed with obstructive sleep apnea. That's gone up from 40 million, which I heard of just a few years ago. It's not getting better, it's getting worse. Centralized medicine has too many roadblocks to get 54 million people treated. And telemedicine, like you're doing, Shirley, and the online sleep testing that I'm doing, and even the offering of the snore device, finding patients, they're interested in snoring. They're not interested in getting a sleep study. You try and market for a sleep study for patients outside your practice, it isn't going to happen. But if you can talk to them about snoring, this is
Yep.
entry level that allows people to think, okay, I snore, I want to have that, and this $60 inexpensive device to get them started on the road towards diagnosis. This is
Yeah.
where dentists and physicians and chiropractors need to start, with you and your and your $9.95 snoring PDF that that people can buy the video. That's
Mm-hmm.
the way to do it. A $10 item that you can offer, a $60 item that I can offer, and then if you want to, even a $79 tracker, which looks just like the snore device, that allows people to, you can get these to a patient, use them over and over again as a dental office, and get this and track how, whether they're sleeping on their side or not, and then if their snoring is related to their body position of sleep. So side sleep positioning is very important for these patients. Some of them, at least 70%, have snoring related to position. I don't know, but I think there's a few people that snore as a result of their tongue, Shirley, and
Yep.
most of them have it in soft palate. Now, I know that snoring weakens the axons in the soft palate. It makes the soft palate even more and more soft and flabby.
Right.
Your snore exercises strengthen those back up. Is that correct?
That's right. That's part of what we do.
So the damage that's done by the vibration of snoring, which is axonal, will be, and also the muscle fibers themselves are damaged in the soft palate, that
Mm-hmm.
uvula elongates. All those things can be repaired by, first of all, having them do something about the snoring, and also having them do something about strengthening those muscles back up, which you do. So this entry-level snoring issue can be the marketing campaign for dentists and chiropractors who are interested in bringing more sleep patients into your practice. And that's one of the biggest things that I can see an advantage of these entry-level snoring solutions.
I was talking to a friend of mine last week, and she's like, "Oh, Shirley, these dentists, they're all nervous. They don't want to get into sleep because then they have to start working closely with physicians."
I do.
And I said, "What?" And what you just described is exactly how a dentist can practice in the world of sleep and not have to deal directly with a physician that's, I don't know, maybe they don't want to answer the phone or
Yeah.
whatever. They can start with these snore devices. They can start with myofunctional therapy.
Right.
They can move on to the home sleep study that they can get online.
Yeah, I hear you.
And,
Yeah.
once they're really there, then
Yeah, let me get this straight. I want to make this very clear. I want dentists to work with their local physicians, and there are many out there, um, sleep dentists who have very good relationships with their local MDs and good cross-referral relationships. But there are more dentists, I can tell you, there are more dentists who have run into roadblocks than it should ever have happened. And there are those who are prejudiced against dentists, myofunctional therapy, and any kind of alternative treatment. And that's why I want to do this. Now, the other thing is, when you start bringing these patients in from a snore campaign, you're going to be actually be referring more patients to the physicians. I think it's going to improve your relationship. I don't think it's going to damage it at all.
right.
And I just saw on a seminar just about a week ago that they now have an HST, a home sleep study, that fits on one finger. One finger. How are the people who are trying to protect their turf going to be able to prevent these sleep studies being done? It's not going to happen. We need more sleep studies done, not less. And I never claimed to be as knowledgeable as an MD sleep physician on sleep disorders. I don't want to do that. I
At
treat
least
it.
we're looking.
That's it. That's all. But we want to help the vast majority that have that disorder. So it's really been good to talk about this. I think we need to clarify these issues.
I agree. So what some people might want to know what happens with a referral to me. So I would send a health history. They would also send the photographs. We would have an online appointment. And if I'm on the ball, I'll record the online appointment. And then I will send the doctor a referral report with my findings.
I see.
And if we have the photos, then, well, I'll usually have the photos, but I also send the photos with different arrows here and there to show what my findings were and to let them know that this is what the treatment plan is going to be and whether or not the patient has agreed to the treatment plan.
Yeah, I've seen your screening form, Shirley. It's very professional and extremely helpful to help dentists look for what they need to look for. So
Thank you.
thank you for that. That's amazing. That's an amazing screening form. Well, look I have enjoyed this discussion. We don't want to get too much longer here. I know that there are people that need to get back to their coronavirus activities, whatever that might be. Anyway, I appreciate you getting online. I'm looking forward to doing another chat with you in the future on maybe another subject that would be of interest to our listeners. So thank you, Shirley, for this time.
You're very welcome. Thanks for asking me. It was
So
fun.
Shirley, where would they go if they want to look you up online?
Primalair.com.
Primalair.com. And
On Facebook, it's also Primal Air.
And my website, the easiest one is snore.com. It's SNOOOR.com. You can reach me there, or you can purchase your product there. We have bulk discounts for dentists and physicians and chiropractors. So if you would like to buy these in bulk, just send me a quick note when you get on there. There's a place to contact me, and I'll make sure you get the bulk ordering code so that you can get substantial discounts on 10 or more of these products. So thank you, Shirley.